Hello everyone, this is Dr. Costa, and in this video I am going to talk about the similarities and differences between current PACES format and new PACES format, which is otherwise known as PACES 23. I am also going to talk about my thoughts about PACES 23 and why I think the new PACES format would be more beneficial to the candidates. So let's get started. But before starting, smash that subscribe button because I need 1000 subscribers as soon as possible for the channel monetization. Here you can see the new PACES format or PACES 23, and in this format you can easily see that we have 5 stations, station 1, 2, 3, 4, 5, and 5 minutes interval between these stations. Now you are seeing the old PACES format. Here you can easily see that we have 5 stations and 5 minutes interval between these stations. Now please focus on the station 3, which is the cardiovascular and neurological stations of 10 minutes time. This station 3 is exactly same in the old PACES carousel and new PACES format. This is the new PACES format, and you can easily see that the station 3 is exactly same. Now let's get back to the current or old PACES format. Here you can see that we have station 5, which comprises of 2 brief clinical consultation stations of 10 minutes of time. In new format there is no brief clinical consultation stations. Again, let's get back to the old PACES carousel. Here you can see that we used to have a station 2, which was a pure history taking station of 20 minutes duration. In the new PACES format we do not have any pure history taking station. Instead of brief clinical consultation station and pure history taking station, we have consultation stations, which are station 5 and station 2. These are 20 minutes long stations, and I think these two stations are more practical than previous station 5 and station 2. This is the old PACES carousel, and here you can see the candidates used to get 20 minutes to take the history from the patients and to answer the questions from the examiners. But in reality, have you ever seen a doctor to take only history from the patients? I didn't see that. Doctors usually take history, then perform clinical examination, then try to manage patients' concerns. So the pure history taking station, station 2 of the old PACES carousel was not practical. Again, the station 5 of old PACES carousel, the brief clinical consultation stations, were also not practical because 10 minutes time was too little to take brief history from the patient, examine the patient, managing patient's concern, telling the patient briefly about the management plan, and then answering the questions from the examiners. So now in the new carousel we have 20 minutes time for the consultation. Candidates would get 15 minutes to take history, perform physical examination, managing patient's concern, and the last 5 minutes would be dedicated to the question and answering session with the examiners. I think 20 minutes is more practical than 10 minutes because it reflects the real consultation sessions that we doctors perform in reality. Again, in old PACES carousel you can see that the station 4 was a communication station and it was 20 minutes long. Here many of the candidates faced difficulty to keep the conversation going for 14 minutes. But in the new PACES carousel, the communication stations are divided into 2 10 minutes sessions. So here the candidates would have to talk with the patient or surrogate for 10 minutes and the examiners would remain passive, which means examiners would not ask any questions to the candidates. They would just observe the communication session and give the scores. In the previous PACES carousel, there was 5 minutes time dedicated to the examiners to ask about the boring ethical and legal questions. So in a nutshell, the previous station 2 and station 5 are going to be more practical and the structure of these stations are going to be changed, but the clinical examination stations like neurology, cardiology, respiratory and abdominal system would remain same in structure and duration. In the new PACES carousel, we still have a total of 8 patients encounter and totally unchanged station 3. Now I am going to share with you my own thoughts about PACES 2023. I think the PACES new format is going to be more practical and it would bring benefits to the candidates, which means more candidates would pass PACES examination because the station 2 and station 5 of the new format are going to be more practical. If you compare these two stations with the previous brief clinical consultation, the new stations would give candidates more time to take history and perform clinical examination. So the candidates would get more information from the patient and they would be able to reach the correct diagnosis. In addition, the communication stations would be shorter, so the candidates would be able to keep the conversation ongoing for 10 minutes of time. As a result, the new format would be more candidate friendly.